It is a funny story, I guess. So high cholesterol runs in my family, uh,
Hmm.
especially on my mother's side. And a few years ago, I got my cholesterol tested. It was like 300. So the doctor's panicking. We got to put you on statins. We got to put you on statins. So I
What?
said, give me 30 days to see what I can do. I went full carnivore,
Mhm.
nothing but meat. Came back, my cholesterol dropped like 90 points. And she said, what did you do? I said, I ate nothing but meat for the month. She said, well, keep doing what you're doing. So,
Good.
and I'd bring in studies. I'd bring in this, the literature, like publications. Oh, thank you. But I know, it's just not standard of care to not prescribe a
Right.
statin.
Statins are
Absolutely.
poison. Yeah, I mean, okay, so you and I agree that from what I've read, there's no benefit to statins whatsoever. The statins are treating a lab marker. They're not treating a health outcome. And so you might get your LDL
Yeah.
down a little bit,
Yeah.
but to what end? You need cholesterol. Cholesterol is a healthy thing. And there's no improvement in life expectancy for people who are on statins. And there are dangerous side effects that include
Yep.
dementia, or I should say, increased risk of dementia. So it
Yep.
bothers the heck out of me when my friends, I'm 59, I got a lot of friends my age, are prescribed statins and taking them
Yep.
out of fear. Like they're not
Yep.
symptomatic in any way, but they have a cholesterol reading that would have been considered normal in the 70s, but now
Yep.
is considered
Yep.
alarming. A doctor prescribes statins. They're not fully informed of what they're called side effects, but what the other effects might be. And they're somehow treating their lipid panel like it's a
Yes.
report card and they're in
Yes.
school
Yeah.
and this is their grade. And I want to tell you a story about my mother because I remember this vividly. This is prior to COVID. I got a phone call from my sister. I was in Denver, Colorado at the time. And she said, Mom's not doing good. The doctors give her, maybe 4,
Mm.
maybe 6 months. She's lashing out at her caregiver. She's having terrible tantrums. They have to kind of force her pills down her throat. And she's abusive. The only thing that calms her down is her classical music. My mom died of dementia. But at this time, although her brain was gone, she wasn't
Mm.
feeble. Well, I said, why
Yep.
give her the pills? I mean, if the pills
Yep.
are what's bothering her, if that's the sort of what initiates all this conflict between her and her nurses, then just stop
Yep.
giving her the pills. My sister said, but she needs those pills. Oh, what does she need them for? Well, for
Oh. Yeah.
cholesterol.
Yeah.
And I said, what? I forget how old she was, but what does
Yeah.
an 82-year-old woman with dementia and 4 months to live give a crap about her cholesterol for? And my sister said, you're right. In my entire 59 years, Kevin, I have heard my sister say to me, you're right, one time. And that was it.